It's a real honor for our team, our pediatric palliative care team, to be an honoree for the Circle of Life Awards. This team has been working away for about 11 years in the only freestanding children's hospital in a 5-state area. So pediatric palliative care is that extra layer of support to both the primary care teams, but also to the families of children who are living with chronic, complex, life-limiting diseases. So what our team does, and we consist of physicians, nurse practitioners, social worker and chaplaincy, and nurses, and our role is to carry the story of that child and that family so that from one acute hospital episode to another, where the staff, primary care staff might change, they recognize our faces, they know us by name, we know them, and we know their entire history. We sometimes have relationships with kids that last for years, depending on what their condition is. I'd say other organizations that want to make strides like we have in connecting patients and families and communities is to look at digital media. I mean, technology is where we are today. So by innovative use of a Facebook page to connect communities together, Facebook Live events like we've done, podcasts, video casts, all of these things allow a family at their own time and at their own pace to get information about what it might be like to care for their children. So for example, we found that one of the peak periods when parents are online connecting is 10 o'clock at night. So you can imagine someone with a child in a rural area who wants to connect with another person for advice on, say, ventilator settings for their child. Well, they can do that. They can do that at 10 o'clock at night. They can do that at 11 o'clock at night. So it allows them, as they need, to access information and access the community of parents who, like them, are living with children in their homes with these chronic diseases.